Coming up today, he was sick in bed on a family vacation, but in a weird way, it was good because that illness helped spot cancer. What doctors saw that led this survivor to see a urologist. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Tyson Bell admits it was his mom who urged him to visit the emergency room. He went in for some awful back pain, but left with the news that his prostate was slightly enlarged. It was Tyson's mom again who urged him to take that news seriously, and in doing so, his mom may have saved his life. Tyson is here in studio with us this morning alongside radiation oncologist Dr. Ronald Chen. Dr. Chen is one of the country's leading experts in radiation oncology. He is the chair of radiation oncology at the University of Kansas Cancer Center. Good morning to you both.
Good morning, Jess.
Good morning. Good morning, Tyson. Thanks for being here and sharing your story. This story of prostate cancer, this journey in which led you to learn this news, actually began on this trip to Costa Rica. What made you end up in the hospital?
I believe we got food poisoning, but it's still undetermined. But my son and I got really sick on the trip. We had to have a doctor come to our room, hook us up to IVs. It was pretty rough. I think his temperature was 106. Mine was around 105. I
cannot imagine being out of the country, sick. You got your kids with you, and you shared a photo of you, as you mentioned, in the hotel room, hooked up to this IV. Describe again just how sick you were, and were you thinking it could have been anything else, or was it just an easy leap to think it was food poisoning?
Yeah, I don't think it could have been anything else. To spare you the great details, it was all night.
Yeah, we've all had some type of food poisoning. We know what that's like.
Right.
We take your word for it. But again, to have to be out of the country, away from your comfort zone of your home, and to be hooked up to IVs, it must have been pretty serious. You come home, you're still not feeling well. Right? How did you end up then going to the emergency department once you got back home?
So it was maybe about 4 days after I had returned. I woke up in the middle of the night with extreme back pain. I mean, probably the worst I'd ever experienced. And so I crawled to the restroom, I crawled back to my bed, called my mom in the morning and said, something's wrong. And so she forced me to go to the ER, which I normally don't ever do.
So this happened at another hospital, but when you were there, what tipped the doctors off that something was going on with your prostate?
So they did some scans on my stomach area, and they said that everything looked okay except for that I had a slightly enlarged prostate. And
what did you think when you heard that?
Yeah, that kind of just threw me off, like, well, that's weird. Maybe it was an infection from the trip or something in that sense. So I kind of dismissed it a little bit.
Yeah, that's what I was gonna. I was just curious to think, is that something that would normally concern someone? Dr. Chen, I mean, I guess if you hear that, is that a reason to be alarmed, or is that a reason to immediately go get checked by your doctor if you hear that it's even just slightly enlarged?
I mean, probably wouldn't make me think of prostate cancer to start with. Some men do have enlarged prostates. I think that's often a normal finding. I think this really was sort of just a fortunate coincidence, actually.
Right. So did you have any other signs or symptoms looking back, like leading up to that back pain and before you learned that news? Any other signs or symptoms that you may have connected?
A few years back, there were a few things like maybe difference in my urine stream or something like that, but nothing that would have jumped out like, hey, something's going on. It was pretty much business as usual. Right.
And how old are you?
I'm 46. Sorry, 46 now.
46.
Yeah.
Okay. And is that Dr. Chen, just help us connect the age dots there. Is that a typical age where somebody might see these signs or symptoms?
Well, so prostate cancer often is silent, and so I think that's why screening is so important. I think 46 is quite young for prostate cancer, although some of the screening recommendations, which we'll talk about a little bit later, do go down in the 40s to start screening for prostate cancer for men who may be at higher risk.
So you get this PSA test. What did they find?
At the first test, they found it was elevated to 43 point something, which is, I mean, it should be under 2 or under 1, I believe.
What is it, Dr. Chen? What's the number? What it should be 4, and we're talking 43, so
43.
That's no good.
Yeah.
Had you heard of? Is PSA something you were familiar with? Something you had checked in on?
No, so when I first got the results, they come in on the app. So I hadn't talked to a doctor or anything, and I saw those results. And so what everybody does is
Google.
they Google. So I Googled and learned I was dying. That's basically what Google told me.
Right.
So I started panicking, and all of that set in. So, but no, I did a lot of reading that night, probably all night, just reading about it.
Went down the rabbit hole, the Google rabbit hole.
I did.
Well, I'm a mother, and so free advice today is, of course, always listen to your mother.
Right.
You shared a photo of your mom, Marcia, with your daughter. Is this Jasmine?
This is Jasmine.
Marsha and Jasmine. So it was Mom who encouraged you to come here to the Cancer Center to get a second opinion. What was that conversation like with Mom?
Well, I had the biopsy at another hospital, and when the results and everything came back, she immediately said, you need to go to KU. You need to find somebody at KU, just because of the reputation KU had with cancer treatment. And so I spoke with my urologist at the other hospital, and he agreed. And he said that he would try to get a referral set up for me to come here to see someone.
Well, glad you did. Had you been seeing a doctor regularly just through your 20s, 30s, 40s? What was your normal?
I usually get an annual physical.
Okay.
And everything turns out, just fine. I guess the biggest problem is they don't test for everything.
Was that your first time getting your PSA tested?
It is.
That was?
It is.
Okay.
Yeah, at 45.
So you end up meeting with Dr. Chen, and Dr. Chen, I want to rewind just a bit. Is it fair to somewhat say that food poisoning was a good thing, that he got sick enough to then have to be sent to the hospital and check this out? Could this have been caught some other way? You say it's silent.
Absolutely. I think it was fortunate that Tyson was able to get a CT scan for some other reason, found an enlarged prostate, which I think is also not related to cancer, which led him to get a PSA test. I think it was all a fortunate coincidence. I think without that, this cancer probably would have grown further and metastasized further, which I think, so ultimately I think this was a fortunate coincidence.
So where do men get their PSA tested? Is it something they have to ask for? Where do they get it? When do they get it?
Yeah. So prostate cancer, as I said before, is often silent, and so you usually have no symptoms from prostate cancer until it's way too late. That's why screening is so important. And so PSA is a blood test that currently is the best way to screen for prostate cancer. There's no other better test to screen for prostate cancer than PSA. You usually get it from a primary care doctor. And the national guidelines differ a little bit, but what I usually tell patients is that men should start screening for prostate cancer, get an annual PSA starting at age 50. So 50 for most men to start getting their PSAs every year from their primary care doctor. For men who have a higher risk for prostate cancer, which include people who have a strong family history of prostate cancer, Black men also are at higher risk. Some guidelines say that should start as early as age 40 to 45. So higher risk, age 40 to 45. Other men start at age 50. PSA is the best test for that.
Do they need to ask for it?
I think sometimes you do have to ask for it. I think some primary care doctors are aware of the guidelines and will do it. I think for some other doctors, I think you probably have to advocate for yourself and ask for a PSA if you're at the right age. Now, I would say nobody should be asking for a PSA in their 20s and 30s. I think sometimes over-testing is not a good thing because you find things that are not accurate. But based on guidelines, age 50 or 40 to 45 for higher risk men, that's when we should be getting PSA every year. Explain
the PSA number a little bit more, because Tyson was at a 43. You say it needs to be at a 4 or under?
Yeah, so it could get very complicated, but I think thinking sort of as easy as possible, I usually use a cutoff of 4. So below 4 is probably okay. Above 4 probably needs to monitor a little bit more. And of course, Tyson's numbers at 43 to 45, that clearly signals that there was a problem. So when you met Tyson for the first time, there was a question to whether or not it had metastasized. How do you make that determination? For every cancer, I think one of the most important things to do up front is to know exactly where the cancer is and whether it has spread, because that really determines how to treat it and the prognosis for the patient. So for prostate cancer, nowadays, the best way to determine metastasis is with what's called a PSMA PET scan. It's a type of PET scan, PSMA PET scan, specifically looking for prostate cancer metastasis. That's what we usually order these days. For somebody who's newly diagnosed with prostate cancer and has aggressive features, we will get a PSMA PET scan to see if it's spread. So you tackled this pretty aggressively. What was the treatment path for Tyson? Well, Tyson unfortunately did have a few spots of metastasis. I want to sort of use a technical term that we call oligometastasis. So actually now with cancer treatment, there are patients who have cancer spread, but we're grouped them into oligometastasis when it's only a few spots, or something a lot more that's spread everywhere. So for the group of patients where it's only spread to a few spots, oligometastasis, we actually can treat some patients very aggressively with even trying to cure the cancer. So historically we thought once the cancer is spread, we have no more hope. But actually with advances in treatment, for patients now with just a couple of spots of metastasis, we actually can offer hope by treating aggressively and potentially achieving a cure.
Is that with brachytherapy?
Well,
tell us about it.
So Tyson had an aggressive treatment course that we designed just for him and just for his diagnosis. To treat the prostate, it did involve brachytherapy, which is a procedure that we do here at KU, where we insert radiation seeds into the prostate. You can see the video here. It's actually a very nice procedure where we can deliver a very focused dose of treatment exactly into the prostate. It's the most aggressive way to treat prostate cancer, and also very focused, so with minimal surrounding dose to other organs outside the prostate. So Tyson's treatment course did involve brachytherapy. We thought that was the best way for us to get rid of the cancer that's inside the prostate.
When you say you designed it specifically for Tyson, explain a little bit more about what you mean by that.
Well, I think it's really important that we individualize cancer treatment. You know, prostate cancer is not just one disease. It's just different stages and where there's spread, and maybe spread to different parts of the body. It's really important that at a cancer center here at KU, we design the treatment specifically for each patient. Sometimes we use brachytherapy, sometimes we use external radiation, sometimes we use proton therapy. If there's metastasis, we design the treatment specifically to those spots. Sometimes we need hormone therapy. It's really important that at a place like KU Cancer Center, where we offer all the different options, we're able to adapt the treatment to each patient and not give the same treatment to everybody.
And when you talk about brachytherapy and these seeds, what happens to the seeds? Are they removed? Do they stay? What's going on in there?
So the type of brachytherapy that I perform is called low-dose rate brachytherapy. It's a one-time procedure. We actually put the physical radiation seeds in the prostate, and we just let the seeds deliver the treatment inside the prostate, and we do not remove them. So there's no second procedure to retrieve these seeds back.
Tyson, I'm looking at you across the table and I'm thinking, you were just on a vacation with your family trying to have a good time, and now here you are sitting with Dr. Chen, hearing all these big words thrown at you, and trying to go through this very specified plan to get you in remission. What was it like when you heard that you had cancer, and then Dr. Chen comes along and is telling you exactly what he's going to do to get you better?
Yeah, I mean, at first it's devastating. Mm-hmm. You think about, it's just kind of like your life flashes before you at first, but hearing everything from Dr. Chen, he was extremely comforting and very knowledgeable, which gave you kind of a sense of, okay, maybe there is a path forward as opposed to doom and gloom, right? And so just hearing that, gave me a little bit of hope. Of course, my mother is in my ear all the time, like, you're gonna make it, you're gonna make it. Very, very strong in faith. So, prayers all the time, just relying on God to carry you through those low moments. But, your whole life changes.
Sure.
Yeah.
Mom, God, Dr. Chen, that's a good team.
Children.
I like that. Yeah. And your children, I know your children. It's Jasmine and
Tyler.
Mm-hmm. So how were you feeling in the days and weeks after treatment? What was recovery like for you?
Before this, it was life as usual. So I felt, pretty normal before all this happened. After all the treatment started, my energy level just completely disappeared. I lost a lot of weight, so I'm a little thinner. I've lost about 25 to 30 pounds throughout this whole process, but that's just from clean eating. I've changed my entire lifestyle over this, so yeah. Were
you able to work?
I was. Thankfully, like I said, God puts you in the best predicaments. I had a job change right before all of this started, and I'm able to work from home now. So it was really helpful to get treatment and then be able to go back home and kind of, put on some sweats and sit at your desk and do your work from there.
Perfect
So,
timing.
yeah.
You're on hormone therapy now, correct? Tell us about that and why.
Hormone therapy is horrible.
Okay,
if I could just be
honest.
You take some pills, you get shots every month, but it takes away all of your testosterone, I believe, because that's what they think feeds the cancer. And so as a man with little to no testosterone, you lose strength. I go to the gym often, but I notice I'm lifting lighter and lighter weights each time. You get hot flashes, having one now, so, but you get hot flashes all of the time, so, a lot of women are always, the older women in my family are always like, yeah, now you know.
Yeah, now you know how we feel.
Yeah.
I like that.
Yeah.
Dr. Chen, so that was new to me. We were just talking about this actually before we went on air about hormone therapy. Is this typical, any man that goes through this, or who needs to have the hormone therapy?
For men with prostate cancer, if it's on the aggressive side, with radiation, we often add hormone therapy. We basically tackle the cancer in a couple of different ways with radiation and hormone therapy when the cancer is aggressive. And there have been many, many, many clinical trials to show that adding hormone therapy to radiation help us increase the cure rate for many of these patients.
So will he eventually be able to come off of that?
Yes. So when we're treating a patient to try to cure the cancer, the goal is not to treat them for the rest of their lives. And so when we're treating with curative intent, we will stop the treatment at some point and then be done with it. In Tyson's case, he probably will get about 2 years of hormone therapy because his cancer had metastasized, is quite aggressive. For other patients, it may be shorter term just based on the stage of the patient.
So he came to you, Tyson came to you as a second opinion with the advice of his mother. How does somebody know to ask for that second opinion? And then, of course, how do they go about asking for it?
Yeah, I think to be quite honest, thinking from a patient's perspective, if I were diagnosed with a serious condition like cancer, I probably always want to ask for a second opinion to make sure that I'm hearing about all the options available from a couple of different doctors before making such a major decision. I think always good to ask for a second opinion for cancer. Now, you can ask your doctor who diagnosed you for a second opinion. Sometimes this seems a little bit awkward, but you can also ask for a second opinion yourself. So if somebody were to want to come to the KU Cancer Center for a second opinion, I usually just say, Google KU Cancer Center second opinion, and the number pops up to call. It's actually very easy. We have nurse navigators who will take the phone call and get you to the right kind of doctor, prostate, lung cancer, breast cancer, whatever. So I think always advocate for yourself and always look for a second opinion for cancer.
I have to ask that question because I always want people to leave hearing what you have to say, feeling comfortable asking for one themselves or talking through it with their physician. Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. You mentioned that you had changed your lifestyle quite a bit since this diagnosis. Tell us a little bit about that. What changes have you made?
Oh, man, I exercise a lot now. So I do walks, several miles. I try to do it, it's a little cold now, so I don't do it as much, but I ride my bike and I work out, I lift weights, a few times a week. I also swim. And just to keep myself moving and, because often you're tired a lot, for some reason. The drugs make you tired, so it's kind of important that you push yourself through it just to keep that, your metabolism going, your body, just help your body stay in shape.
What diet changes have you made?
So I don't eat any fast food anymore. I don't touch it. I used to have a bit of a sugar addiction. And so I cut most sugar out of my life. I do get a cheat day once a month, but I eat a lot of fruit, a lot of vegetables, a lot of beans, nuts, whole grains, things like that. I don't eat a lot of meat. The doctors probably tell me I should eat more, but I think my protein levels are pretty good from the diet I'm on. But yeah, I try to stay away from all of the poison that's out there.
Yeah. Dr. Chen is shaking his head. He's very happy with what he's hearing. It must make you happy, though, to know that people are willing to make these big, big lifestyle changes, the things that they can control, right? Yeah. And how much does that really play? We always say eat well, exercise as much as possible, Dr. Chen, but how much does it really play a part in prevention and then post-care and getting into remission?
Yeah. First of all, I think Tyson is doing an incredible job, and he really is a great example for other patients to learn from. Since I specialize in prostate cancer, I talk about hormone therapy a lot, and a lot of men read about hormone therapy and side effects, and they read about, well, the hormone therapy drops your testosterone, it can cause you to feel tired, you may lose muscle mass, you may gain a lot of weight. And what I usually tell patients is, yes, it could cause that, but you can also control that yourself. Tyson's a great example. So instead of gaining weight on hormone therapy, he actually has lost weight by eating healthier and doing regular exercise. I really do think that eating healthier and doing regular exercise can help reduce the side effects of treatment. It can actually make you healthier overall and be able to have less fatigue from the hormone therapy.
Tyson, you were pretty open and you shared that you're really trying to work through the mental aspect of this diagnosis. What have you experienced personally?
That's a roller coaster. You have your ups and downs. Some days you cry a lot. Other days you don't. There's always a big question mark, especially you get tested once a month, and I get scanned every 3 months, and so there's a lot of anxiety that comes with that, wondering, if it's going to come back, if you're not doing enough, especially when they don't know exactly what causes it. I had my genes tested, everything looked fine, so there's really there's nothing that can say this is specifically what you did that caused you to get the cancer. So you've always got this thought process like, okay, am I going to do this? Is this going to cause it to come back? Am I going to get another cancer? Like you just think that all the time.
And I bet a lot of that's because you have 2 young kids that you really need to be there for long term.
Yeah.
Have you done anything in particular that you've found to be helpful? Any advice you can give somebody who's going through it or may be going through it eventually?
Yeah, when I first was diagnosed, I wanted to keep it a secret from everybody, so I wanted to deal with it on my own. And that's probably the worst thing that I could have done, just because, the people that love you, they offer that support that, you can't get alone. Spend a lot of time in prayer, but even at that, God provides other people for me, and that fill that gap. When I'm down, they're like, hey, come on, I went to the KU game recently. I normally don't go out, but my daughter was like, no, come on, let's go out, and so it's they just kind of bring you up in those down times.
And Tyson, they want to do that.
Yeah,
people
for
are
sure.
always wanting to find ways to be there for you. It's tough when someone you love is diagnosed. And can I ask you, you said you didn't want anybody to know? Was it with a cancer diagnosis? Was it because it was prostate cancer? Was there any stigma there that you were trying to get past?
A little of all. I'm usually a private person, so this was different for me. But yeah, it's a little bit of embarrassment. Like, what did I do to cause this? And then you also think that you don't want to get that specialized treatment from other people. Like, oh no, he has cancer. We have to do this or walk on eggshells, or you just want people to be normal around you. In a sense.
And it's hard to do, yeah. Dr. Chen, how important is it for folks like Tyson to find that mental help and that support in the community, and it's okay to talk about it?
Yeah, I think it's so important. Anybody who has a serious medical condition like cancer, it's absolutely normal to have emotions. It's absolutely normal to cry sometimes and to sort of work through all of that shock. Now, cancer treatment is tough physically, but it's also tough mentally. I think some patients have great family social support, and they can rely on that. But for patients where it's a little bit too much emotionally, always ask for help. I have patients who tell me that they need a little bit of help. We have a great psycho-oncology service here of psychosocial professionals who work with cancer patients specifically, and they can really help. So ask for help always. I think this is really an important part to be able to make sure you're mentally healthy during the journey of cancer.
Where does Tyson's cancer stand today?
He's doing really well. Tyson can tell you he is in remission. His checks look good. We've designed an aggressive course of treatment that looks like it seems to be promising, and he's doing very well. Let's get to some questions from our viewers this morning. And Jeremy wants to know,
what exactly is the PSA? I know a high number is a red flag, but what exactly is happening that makes the number high or low?
Yeah. Prostate-specific antigen, PSA, prostate-specific antigen, is actually something that's released into the blood by actually prostate cells. So any person who has a prostate would have PSA in the body. The higher the level, it seems like then the more the prostate is, it can also indicate cancer. And we usually use a 4 as a cutoff. It's not a perfect cutoff, but we also look to see if the PSA is going up and up over time as well to indicate something is growing. But PSA is released by the prostate into the bloodstream, and we use that as a way to screen for cancer.
Jill wants to know, how does a person know if they are high risk for prostate cancer to ask for that early PSA test? Do they need genetic testing?
Genetic testing would not be the first thing that I would jump to. To ask for an early PSA test, what I usually tell men would be if you have a strong family history of prostate cancer. If my father had it, my uncle had it, my grandfather had it, if it runs in the family in a very strong way, I think then that man is at high risk, and I would ask for an early PSA test starting at age 40 to 45. Also, black men. We know black men in general have a higher risk for prostate cancer. Also, they develop it earlier in life. And so those are the two categories where I usually advise earlier screening.
Sandy wants to know, true or false, if men live long enough, they will be diagnosed with prostate cancer eventually in their lifetime.
I think in general that is a true statement. I think what I usually tell patients is that the prostate eventually goes bad. Now, I think what's really important is that not all prostate cancer is deadly. And so many men will develop prostate cancer as they age, maybe very older age, but that could be very slow-growing prostate cancer that may never need treatment. I still think regular screening is important, and if we screen, we can find prostate cancer that's either aggressive and needs treatment or not aggressive that can just be watched. So screening is still important. But yes, most men, if they live to an older age, probably will develop prostate cancer at some point.
Tyson, thank you for sharing your story today. What do you want the big takeaway to be from that?
I think the big takeaway is that, if you are diagnosed with cancer, that there is hope. Don't lose yourself in thinking that everything is, over. Look to your family, your friends, rely on those people for support. But the best thing to do is just take it one day at a time. And, if you feel good today, that's great. Don't worry about yesterday and don't worry about tomorrow. Just live in the moment, trust in God, and find the right doctors. That's pretty important as well.
Ask for that second opinion.
Yeah.
And just thank you so much for being so open about all aspects of your story. It's never easy to talk about our health journey, but thank you so much. Dr. Chen, for those listening, what's the big takeaway today? Yeah,
first I want to thank Tyson for coming on here. I think it's really courageous to come and share your story, but I think a lot of people will benefit from the episode today, from Tyson's story. The big thing I want to leave with is this word oligometastasis. Oligometastasis is a condition where somebody has cancer, it's spread, but only to a few spots. In that situation, sometimes we can still treat aggressively and offer hope to the patients. We actually have developed an oligometastasis program here in the KU Cancer Center because we're realizing more and more that these patients can be treated aggressively and potentially even be cured in some patients. And so that's the big takeaway, and I think we'll probably do an episode dedicated on that at some point in the future. Okay, let's do it. I like that pitch. Thanks, Dr. Chen. Always good to have you. Again, Tyson, thank you so much. Thank you. Thanks to our guests. Thanks to our viewers for being with us today. We'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update, how to spot plaque before a heart attack. We explore the quick, painless test giving you an inside look at your heart health. I'm Jessica Lovell on the next Morning Medical Update. Hear from one woman who had no clue her arteries were clogged until she got this scan. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.